Welcome to my channel. In this video we are going to learn about spinal cord. We are going to see about its introduction, positional changes of spinal cord, spinal meninges, external features of spinal cord. Spinal cord. It is lower elongated part of central nervous system. Central nervous system consists of brain and spinal cord. Spinal cord is lower elongated part of central nervous system. It is cylindrical in shape. It occupies upper two-thirds of vertebral canal. You can see the spinal cord occupying upper two-thirds of vertebral column. It measures about 45 centimeters in adult males and 42 centimeters in adult females. It weighs about 30 grams. Spinal cord extends from upper border of posterior arch of C1 vertebra to lower border of L1 vertebra in adults. In case of adults, it extends up to L1 vertebra. It extends from upper border of posterior arch of C1 vertebra or atlas to lower border of first lumbar vertebra. These are lumbar vertebrae. It extends up to lower border of first lumbar vertebra. Superiorly, it is continuous with medulla oblongata. You can see the spinal cord. It is continuous superiorly with medulla oblongata. Spinal cord is continuous superiorly with medulla oblongata. Inferiorly, it terminates as conus medullaris. Inferiorly, spinal cord terminates as conus medullaris. Conus medullaris is lower tapering extremity of the spinal cord. Lower tapering extremity of the spinal cord. Spinal cord extends from upper border of C1 vertebra to lower border of first lumbar vertebra. Superiorly, it is continuous with medulla oblongata. Inferiorly, it terminates as conus medullaris. Now let's see positional changes of the spinal cord. Up to third month of intrauterine life, length of spinal cord is equal to length of vertebral column. At third month of intrauterine life, length of spinal cord is equal to length of vertebral column. You can see spinal cord extends throughout the length of vertebral canal. From third month onwards, vertebral column grows faster than spinal cord. Hence, spinal cord lies at higher level from thereafter. From third month onwards, spinal cord lies at higher level than vertebral column because the vertebral column grows faster than spinal cord. At birth, spinal cord ends at L3 vertebra. At birth, spinal cord ends at L3 vertebra. In adults, spinal cord ends at lower border of L1 vertebra. Up to third month of intrauterine life, length of spinal cord is equal to length of vertebral column. From thereafter, vertebral column grows faster than spinal cord. Hence, spinal cord lies at higher level than vertebral column. At birth, that is in newborns, spinal cord ends at L3 vertebra. In adults, spinal cord ends at L1 vertebra. Let us now see about spinal meninges. Spinal cord is enclosed within three meninges. From outside to inside, these are dura mater, arachnoid matter and pia mater. You can see outer dura mater, middle arachnoid matter, inner pia mater. Outer dura mater, middle arachnoid matter, inner pia mater. Dura mater. Spinal cord is covered only by meningeal layer of dura mater. Dura mater has two layers, endosteal layer and meningeal layer. Spinal cord is covered only by meningeal layer of dura mater. The space present between vertebral column and dura mater is called epidural space. The space present between dura mater and arachnoid matter is called subdural space. Space above dura mater is called epidural space. Space below dura mater is subdural space. Epidural space contains adipose tissue and internal vertebral venous plexus. Subdural space contains capillary layer of fluid. Arachnoid matter. It is thin, delicate, transparent avascular membrane. Arachnoid matter is avascular membrane. It invests spinal cord loosely. Both dura mater and arachnoid matter ends at lower border of S2 vertebra. You can see dura mater and arachnoid matter both ends at lower border of S2 vertebra. Dura mater and arachnoid matter ends at lower border of S2 vertebra. Pia mater. It is thin, highly vascular membrane. Arachnoid matter is avascular membrane. Pia mater is highly vascular membrane. It closely invests spinal cord. It is closely related to spinal cord. Below the conus medullaris, it continues downwards as phylum terminal. Below the conus medullaris, pia mater continues downwards as phylum terminal. Phylum terminal is nothing but pia mater. Subarachnoid space. The space present between pia mater and arachnoid matter is called subarachnoid space. It is filled with CSF, cerebrospinal fluid. The space present between arachnoid matter and pia matter is called subarachnoid space. It is filled with CSF. Modifications of pia matter. There are three modifications: phylum terminal, linea splendens, ligamentum denticulata. Phylum terminal. It is delicate, glistening white, thread-like structure. Glistening white, thread-like structure. It extends from conus medullaris tip to first coccygeal vertebra. It extends from tip of conus medullaris to first coccygeal vertebra. It is 20 centimeters in length. It consists of two parts: phylum terminal interna, phylum terminal externa. Phylum terminal interna. It lies within dural sac. We know that dura mater and arachnoid matter both ends at lower border of S2. Hence, from the tip of the conus medullaris to till S2, it is phylum terminal interna, which lies within dural sac. It is 15 centimeters in length. Phylum terminal externa, it lies outside the dural sac. It measures about 5 centimeters in length. Phylum terminal interna within the dural sac, phylum terminal externa outside the dural sac. Phylum terminal mainly composed of non-nervous tissue. Phylum terminal mainly composed of non-nervous tissue, that is pia mater, and it consists of some part of nervous tissue, that is nerve fibers. It is composed of few nerve fibers, rudiments of second, third, fourth coccygeal nerves. Rudiments of second, third, fourth coccygeal nerves. Central canal of spinal cord extends into upper part of phylum terminal for about 5 centimeters. In upper 5 centimeters of phylum terminal, central canal is present. Linea splendens. It is thickening, seen at the anterior median fissure. It is thickening seen at anterior median fissure. It is seen in lower part of the spinal cord. Ligamentum denticulata. These are tooth-like processes. Ligamentum denticulata or tooth-like processes. These are 21 pairs in number. These are 21 pairs. Laterally, they pierce arachnoid matter and attaches to inner surface of dura mater. You can see the ligamentum denticulatum attaching to inner surface of dura mater. It lies in between exits of roots of adjacent spinal nerves. They lie in between exits of roots of spinal nerves, adjacent spinal nerves. It keeps spinal cord in position. External features of spinal cord. The external features of spinal cord are fissures and sulci, attachments of spinal nerves, chorda equina, enlargements of spinal cord. Fissures and sulci. Anterior aspect of spinal cord presents one anterior median fissure and two anterolateral sulcus. Fissure is deep prominent groove. Sulcus is shallow groove. Anterior median fissure, it is deep. It lodges anterior spinal artery. You can see there are two anterolateral sulcus and one anterior median fissure. Posterior aspect of spinal cord presents one posterior median sulcus, two posterior intermediate sulcus, two posterolateral sulcus, one posterior median sulcus, two posterior intermediate sulcus, two posterolateral sulcus. Posterior median septum. It is neuroglial tissue. It extends forward from posterior median sulcus into substance of spinal cord. Posterior median septum It is neuroglial tissue. It extends forwards from posterior median sulcus into the substance of spinal cord. Attachment of spinal nerves. There are 31 pairs of spinal nerves which emerges from the cord. There are 31 pairs of spinal nerves which emerges from the cord. 8 cervical, 12 thoracic, 5 lumbar, 5 sacral and 1 coccygeal nerve. Each spinal nerve is attached to spinal cord by two roots. Spinal nerve is attached to spinal cord by two roots. Anterior root, posterior root. Anterior root is motor root. Posterior root is sensory root. Posterior root contains posterior root ganglion. Each root is made up of number of rootlets. Each root is made up of number of rootlets. Cervical nerves leave the vertebral canal above the corresponding vertebrae except 8th cervical nerve. You can see the cervical nerves emerging above the corresponding vertebrae except 8th cervical nerve. 8th cervical nerve emerges between C7 vertebra and T1 vertebra. Remaining spinal nerves emerge below the corresponding vertebra. You can see 4th thoracic nerve emerging below T4 vertebra. Spinal segments. Part of spinal cord to which a pair of spinal nerves attached is called spinal segment. It is a part of spinal cord to which a pair of spinal nerves attached. There are 31 spinal segments. Length of spinal cord is smaller than length of vertebral column. Length of spinal cord is 45 centimeters. Length of vertebral column is 65 centimeters. Spinal cord is smaller than vertebral column. So, spinal segments are shorter and crowded, especially in the lower part of the cord. You can see spinal segments are shorter and crowded, especially in the lower part of the spinal cord. Thus, spinal segments and vertebral segments do not lie at same level. Spinal segments lie above their numerically corresponding vertebral spines. You can see the spinal segments, they lie above the corresponding vertebral segments. Level of vertebral levels and spinal segments. These are vertebrae. These are spinal segments. Spinal segments. C1 to C8 spinal segments lie at the level of C1 to C7 vertebrae. You can see C1 to C8 spinal segments lie at the level of C1 to C7 vertebrae. T1 to T8 spinal segments lie at the level of T1 to T6 vertebrae. T9 to T12 spinal segments lie at the level of T7 to T9 vertebrae. Lumbar spinal segments lie at the level of T10 T11 vertebrae. One coccygeal segment and 5 sacral segments, they lie at T12 L1 vertebrae. Chorda equina. Nerve roots of lumbar except first lumbar, sacral and coccygeal nerves of both the sides lies almost vertical around the phylum terminal called chorda equina. The center is chorda equina. Nerve roots of lumbar except first lumbar nerve, sacral nerves and first coccygeal nerve. They lie almost vertical around phylum terminal. This is phylum terminal. They lie almost vertical around phylum terminal. There are 40 nerve roots at beginning. At beginning there are 40 nerve roots. It consists of a pair of lower 4 lumbar nerves, 5 sacral nerves, 1 coccygeal nerve. So together there are 20 nerves. Each nerve has 2 roots, anterior root, posterior root. So total there are 40 nerve roots. Enlargements of spinal cord. Cylindrical spinal cord presents two enlargements. Two enlargements. Cervical enlargement and lumbar enlargement. Cervical enlargement. It extends from C4 to T1 spinal segments. C4 to T1 spinal segments. Maximum diameter is 38 mm at C6 segment. It accommodates more motor neurons to supply muscles of upper limb. To supply muscles of upper limb, it accommodates more motor neurons. Hence, there is enlargement. Lumbar enlargement. It extends from L2 to S3 segments. L2 to S3 segments. Maximum diameter is 35 mm at S1 segment. It accommodates more motor neurons To supply muscles of lower limb. To supply muscles of lower limb, it accommodates more motor neurons. These enlargements are produced opposite to attachments of nerve roots, contributing to brachial plexus and lumbosacral plexus. These enlargements are seen opposite to attachment of nerve roots, which contribute to brachial plexus and lumbosacral plexus. Let us now revise spinal cord. Spinal cord is lower elongated part of central nervous system. It is cylindrical in shape. It measures about 45 centimeters in males and 42 centimeters in adult females. It weighs about 30 grams. Positional changes. At third month of intrauterine life, length of spinal cord is equal to length of vertebral column. At birth, it ends at L3 vertebra. In adults, it ends at lower border of L1 vertebra. Meninges, it is enclosed in three meninges from outside to inside: dura mater, arachnoid mater, pia mater. Dura mater, spinal cord is covered only by meningeal layer of dura mater. Arachnoid mater, it is thin avascular membrane. It loosely invests spinal cord. Pia mater, it is highly vascular membrane. It is closely related to spinal cord. Dura mater and arachnoid mater ends at lower border of S2 vertebra. Pia mater, below the cornus medullaris, it continues as phylum terminal. Modifications of pia mater: phylum terminal, linea splendens, ligamentum denticulata. Phylum terminal consists of two parts: phylum terminal interna and phylum terminal externa. Within the dural sac, phylum terminal interna. Outside the dural sac, phylum terminal externa. It is about 20 centimeters in length. Linea splendens, it is thickening, present near anterior median fissure. It is seen in lower part of the spinal cord. Ligamentum denticulata, these are 21 pairs of tooth-like processes. They are present in between the exits of roots of adjacent spinal nerves. They pierce the arachnoid mater and attaches to inner surface of dura mater. External features of spinal cord: fissures and sulci. Anterior aspect of spinal cord presents one anterior median fissure and two anterolateral sulcus. Posterior aspect of spinal cord presents one posterior median sulcus, two posterior intermediate sulcus, and two posterolateral sulcus. Attachment of spinal nerves: there are 31 spinal nerves which emerges from the cord. Each spinal nerve consists of two roots. Cervical nerve emerges above the corresponding vertebrae except 8th cervical nerve, which emerges between C7 and T1 vertebra. Remaining spinal nerves emerges below the corresponding vertebrae. Spinal segments: there are 31 spinal segments. Spinal cord is smaller than vertebral column. Spinal segments in the lower part are shorter and crowded. Spinal segments always lie above the corresponding vertebral spines. C1 to C8 spinal segments lies corresponding to C1 to C7 vertebrae. T1 to T8 lies at the level of T1 to T6 vertebrae. T9 to T12 spinal segments corresponds to T7 to T9 vertebrae. Lumbar spinal segments corresponds to T10, T11 vertebrae. Sacral coccygeal segments corresponds to T12, L1 vertebrae. Cauda equina, it consists of nerve roots of 4 lower lumbar, 5 sacral, and 1 coccygeal nerves. There are 40 nerve roots at the beginning. Enlargements of spinal cord: cervical enlargement, lumbar enlargement. Cervical enlargement extends from C4 to T1 spinal segments. Maximum diameter is 38 mm at C6 spinal segment. Lumbar enlargement, it extends from L2 to S3 spinal segments. Maximum diameter is 35 mm, seen at the level of S1 spinal segment.